Respiratory disease. Respiratory diseases, or lung diseases, are pathological conditions affecting the organs and tissues that make gas exchange difficult in air-breathing animals. They include conditions of the respiratory tract including the trachea, bronchi, bronchioles, alveoli, pleurae, pleural cavity, and the nerves and muscles of respiration. Respiratory diseases range from mild and self-limiting, such as the common cold, to life-threatening diseases such as bacterial pneumonia, pulmonary embolism, acute asthma and lung cancer. The study of respiratory disease is known as pulmonology. A doctor who specializes in respiratory disease is known as a pulmonologist, a chest medicine specialist, a respiratory medicine specialist, a respirologist or a thoracic medicine specialist. Respiratory diseases can be classified in many different ways, including by the organ or tissue involved, by the type and pattern of associated signs and symptoms, or by the cause of the disease. Obstructive lung disease. Asthma, chronic bronchitis, bronchiectasis and chronic obstructive pulmonary disease, COPD, are all obstructive lung diseases characterized by airway obstruction. This limits the amount of air that is able to enter alveoli because of constriction of the bronchial tree, due to inflammation. Obstructive lung diseases are often identified because of symptoms and diagnosed with pulmonary function tests such as spirometry. Many obstructive lung diseases are managed by avoiding triggers, such as dust mites or smoking, with symptom control such as bronchodilators, and with suppression of inflammation, such as through corticosteroids, in severe cases. One common cause of COPD including emphysema, and chronic bronchitis, is tobacco smoking, and common causes of bronchiectasis include severe infections and cystic fibrosis. The definitive cause of asthma is not yet known. Restrictive lung diseases. Restrictive lung diseases are a category of respiratory disease characterized by a loss of lung compliance, causing incomplete lung expansion and increased lung stiffness, such as in infants with respiratory distress syndrome. Chronic respiratory disease. Chronic respiratory diseases, CRDs, are long-term diseases of the airways and other structures of the lung. They are characterized by a high inflammatory cell recruitment, neutrophil, and/or destructive cycle of infection, for example mediated by Pseudomonas aeruginosa. Some of the most common are asthma, chronic obstructive pulmonary disease, and acute respiratory distress syndrome. CRDs are not curable, however. Various forms of treatment that help dilate major air passages and improve shortness of breath can help control symptoms and increase the quality of life. Respiratory tract infections. Infections can affect any part of the respiratory system. They are traditionally divided into upper respiratory tract infections and lower respiratory tract infections. Upper respiratory tract infection. The most common upper respiratory tract infection is the common cold. However, infections of specific organs of the upper respiratory tract such as sinusitis, tonsillitis, otitis media, pharyngitis and laryngitis are also considered upper respiratory tract infections. Lower respiratory tract infection. The most common lower respiratory tract infection is pneumonia, an infection of the lungs which is usually caused by bacteria, particularly Streptococcus pneumoniae in Western countries. Worldwide, tuberculosis is an important cause of pneumonia. Other pathogens such as viruses and fungi can cause pneumonia, for example severe acute respiratory syndrome and pneumocystis pneumonia. A pneumonia may develop complications such as a lung abscess, a round cavity in the lung caused by the infection, or may spread to the pleural cavity. Poor oral care may be a contributing factor to lower respiratory disease. New research suggests bacteria from gum disease travel through airways and into the lungs. Tumors. Malignant tumors. Malignant tumors of the respiratory system, particularly primary carcinomas of the lung, are a major health problem responsible for 15% of all cancer diagnoses and 30% of all cancer deaths. The majority of respiratory system cancers are attributable to smoking tobacco. The major histological types of respiratory system cancer are. In addition, since many cancers spread via the bloodstream and the entire cardiac output passes through the lungs, it is common for cancer metastases to occur within the lung. Breast cancer may invade directly through local spread, and through lymph node metastases. After metastasis to the liver, colon cancer frequently metastasizes to the lung. Prostate cancer, germ cell cancer and renal cell carcinoma may also metastasize to the lung. Treatment of respiratory system cancer depends on the type of cancer. surgical removal of part of a lung, lobectomy, segmentectomy, or which resection, or of an entire lung pneumonectomy, along with chemotherapy and radiotherapy, are all used. The chance of surviving lung cancer depends on the cancer stage at the time the cancer is diagnosed, and to some extent on the histology, and is only about 14 to 17% overall. In the case of metastases to the lung, treatment can occasionally be curative but only in certain, rare circumstances. Benign tumors. Benign tumors are relatively rare causes of respiratory disease. Examples of benign tumors are pleural cavity diseases. Pleural cavity diseases include pleural mesothelioma, which are mentioned above. A collection of fluid in the pleural cavity is known as a pleural effusion. This may be due to fluid shifting from the bloodstream into the pleural cavity due to conditions such as congestive heart failure and cirrhosis. It may also be due to inflammation of the pleura itself, as can occur with infection, pulmonary embolus, tuberculosis, mesothelioma and other conditions. A pneumothorax is a hole in the pleura covering the lung, allowing air in the lung to escape into the pleural cavity. The affected lung collapses like a deflated balloon. A tension pneumothorax is a particularly severe form of this condition where the air in the pleural cavity cannot escape, so the pneumothorax keeps getting bigger until it compresses the heart and blood vessels, leading to a life-threatening situation. Pulmonary vascular disease. Pulmonary vascular diseases are conditions that affect the pulmonary circulation. Examples are neonatal diseases. Pulmonary diseases may also impact newborns, such as pulmonary hyperplasia, pulmonary interstitial emphysema, usually preterm births, and infant respiratory distress syndrome. Diagnosis. Respiratory diseases may be investigated by performing one or more of the following tests. Epidemiology. Respiratory disease is a common and significant cause of illness and death around the world. In the U.S., approximately 1 billion common colds occur each year. A study found that in 2010, there were approximately 6.8 million emergency department visits for respiratory disorders in the U.S. for patients under the age of 18. In 2012, respiratory conditions were the most frequent reasons for hospital stays among children. In the UK, approximately 1 in 7 individuals are affected by some form of chronic lung disease, most commonly chronic obstructive pulmonary disease, which includes asthma, chronic bronchitis and emphysema. Respiratory diseases, including lung cancer, are responsible for over 10% of hospitalizations and over 16% of deaths in Canada. In 2011, respiratory disease with ventilator support accounted for 93.3% of ICU utilization in the United States. 3% of ICU utilization in the